Pelvic floor challenges can significantly impact a woman's life, but no one really wants to endure an invasive surgery. Doctors at Trinity Health have an innovative, safe, effective option called Enplace that could be a solution for many, and they're the only ones in West Michigan doing it. Today, we're joined by doctors Katie McCormick and Josephine Spitzley. They're here to discuss this groundbreaking procedure. Ladies, thanks so much for being here.
Yeah, thanks for having us.
Let's first talk about what pelvic floor challenges look like and what that presents for a woman.
So a woman dealing with pelvic organ prolapse can have a variety of symptoms. These can include pelvic pressure, pain, difficulty emptying their bowels or bladder, and they can also feel like a vaginal bulge of tissue at times.
Okay. And so before this, what were the options for women?
Most people would have a hysterectomy and just take everything out. Or you can get a pessary, and that is a device that goes in the vagina that can be really uncomfortable and bothersome for people. So there wasn't a great option until this minimally invasive option where we can suspend everything in a really quick procedure.
Okay, so let's talk about how this works and what it does.
So the Enplace is a device that allows us to suspend either the uterus or the upper vagina if women have had a prior hysterectomy. And it allows us to place anchors on a ligament within the pelvis called the sacrospinous ligament. And it's a minimally invasive, short procedure in the operating room and then short recovery time too.
Okay. Are there certain qualifications for a woman to be able to have this kind of procedure versus a full hysterectomy?
Because it's a quick, simple procedure that is no big incisions, no big recovery time. Most people are great candidates.
Wow.
As long as they have prolapse. It's an easy way to fix it.
Wonderful. And let's talk about some of the results that you're seeing from these women, being able to go get something done in a day and have their problems taken care of.
Yeah, they are recovering very well. And then when we see them, I know studies have looked at like 2 years out, women are feeling great. 90% of women are happy and asymptomatic after the procedure. Like Josephine says, an outpatient procedure, minimal pain meds that are needed, and are recovering really well.
Okay, perfect. Are there other things that women should know about what this procedure looks like? I mean, they're in and out in a day, right? I mean, this is not an invasive surgery. They're not staying in the hospital, none of these things, and walking out, right?
Right. Yeah, I mean, I think if it's a great option for people that have been frustrated with prolapse, when they're trying pessaries and they really don't want major surgery.
Yeah.
They should consider ditching the pessary and coming to see us.
Right, coming to see you too.
Yeah.
How common is this of a problem for women, would you say?
I mean, I think a lot of people worry about it, especially after just having kids.
Babies, yeah, right.
Depending how many kids and how they were born. If they had a lot of vaginal deliveries, it's fairly common.
Yeah.
And I do think it's something that women don't talk about. So they're at home dealing with these symptoms and are just like, well, it's normal. But it isn't, and there's things that we can do about it and increase their quality of life.
Yeah, wonderful. All right, so say there's a woman out there listening right now, they're hearing this, they're like, wow, I didn't know there was anything I could do about this. What do they need to do?
Call our office.
Yes. Call us.
Come see us.
Yeah.
And we'll talk more about the procedure, do an exam, see if they, qualify, whether or not they want traditional hysterectomy versus the Enplace. And then we'll walk alongside them and get this done, get them feeling better.
I love it. Well, you ladies are a joy. Thank you so much for
Thanks
being
for having
here.
us.
Love it. You guys are working out of Muskegon area, Trinity Health there. So there it is, the Enplace procedure. These are the only two ladies doing this in West Michigan. You want to learn more, you can go to trinityhealthmichigan.org/Enplace. We'll be right back.